Hey beautiful people, and welcome to Team Sauti channel. Today I want us to talk about an important topic that is on taking charge of your health. Many people visit the hospital when they are unwell. They meet with their healthcare provider. They get lots of prescriptions and they go back home without knowing what's wrong with their bodies. It's important to note that when it comes to illnesses, it is your right and you deserve to know what's happening with your body. You deserve to know the kind of treatment you're receiving for the kind of an illness that you have, so as to be able to know how to well support your body to facilitate a quick recovery and to also prevent further complications resulting from that illness. So in this video, I want us to talk about important questions that you should ask your healthcare provider every time you visit the hospital or every time you take your loved one to the hospital to help you understand what's their condition, what's your condition, and how to best recover from the same. So number one, when you visit the hospital, seek to understand what's your diagnosis. First things first, it is quite unfortunate for you to visit the hospital not knowing what's wrong with you, only to come back home still not knowing what's wrong with you, but this time with a lot of drugs. And you cannot really explain the same way you were when you were leaving the home, not knowing what is happening with you. The same way you're coming back, still not knowing what's happening with you. It's very important that you make inquiries, seek to understand what's happening with my body. If, for example, the doctor tells you that you have an infection, seek to understand what kind of an infection is it. Seek to know, how did I contract this kind of an infection? You may also want to know, is it a chronic infection or is it an acute infection, something that will just last a few days and will be done with? Seek also to understand if it's an infection. Is it something that I can transmit to people around me? Knowing the kind of diagnosis that you have is very important because it helps you know how to support your body, what kind of changes you need to make, be it lifestyle changes like diet, be it things like exercise, and also it helps with compliance to the medication and also understanding your body needs at that particular time. So it's very important that when you go to the hospital, you seek to know the diagnosis. Usiseme tu nilipewa dawa, si kuambiwa what was wrong with me. Seek to know what's wrong with you. Now, number two, if you are being sent for laboratory tests or for some radiological imaging, seek to understand their significance. You see, some of these tests come with a lot of financial implications. So you need to understand, if a doctor is sending you for a head CT scan, seek to understand why is it necessary and what are the likely outcomes. And if these outcomes happen, what is the prognosis? What is the possible outcome? How are the results likely to implicate on my life? Seek to understand all those things. Number three, seek to know the treatment plan. What are the treatment options? Yes, you've been sent to the laboratory, you've done all the tests, you've given your history to the doctor, they have told you the diagnosis. Now seek to know, what is the treatment plan for you like? If you're being put on medications, seek to understand, how do these medications work? What are the side effects? How long will I be taking these medications? Because you realize that in our society or in this modern day age, you go to the hospital, let's say with a bacterial infection, for instance, like a bacterial infection, you receive medications. After like 3 days, you're feeling good and you're feeling like you're back on your feet. And many people will now stop taking the medication, especially if you are not correctly told how you should take the medication, and if you do not really understand the importance of compliance to the dosage and for the right period of time. So it's very important that you get to ask your provider, your healthcare provider, how long will I take this medication? Sometimes we have seen, especially our parents and the older generation, people getting diagnosed with issues like hypertension. You're given the medication, you take for a few days and then they stop. And now the next time they are showing up in the hospital, they are worse than they were before, simply because they never got to understand that this was a chronic illness and they were supposed to take the medications for a long period of time. So it's very important that you seek to understand the treatment plan, your treatment plan. Why am I being put on this medication? For how long? What are the side effects? And such kind of things. Number 4, and the last thing, seek to know how on matters follow up. Seek to know, do I need to come back to the hospital, and what are the danger signs that should I experience at home, I should rush to the hospital. Seek to know what are the preventive measures, because you don't want to go down the drain again. You don't want to go down that road of illness again. So seek to know, how can I prevent this disease or this illness from occurring again? Seek to know, when can I come back for a review? Seek to know, what are some of the things that I can experience and I know that I'm on the right path. Also seek to know, are there some lifestyle modifications that you need to pursue for you to prevent that disease from recurring again? Always remember that your health is your responsibility. Do not be afraid to ask questions pertaining your well-being, and always be in charge of your health. If you found this video insightful, don't forget to like, share, leave a comment below, and subscribe to Team Sauti for more health tips.